Aloha, welcome back to General Pharmacology. Let's move to the PowerPoint slides and get started. Right now, we are covering something out of our pharmacy technician book. So if you're watching this looking for Pharm 203 lectures, we're taking a slight detour through this book. I put the notes in the resources section down at the bottom of things that I tend to lecture about without putting on your quizzes, and this is certainly one of them. We have a pharmacy technician program at Maui College, and some of this pharmacy technology stuff I want to incorporate into the Pharm 203 curriculum, but I'm not sure about the timing and what I want to talk about until I sit in front of a camera and go through the slides and figure out how much time I'm spending too much of in certain places and not enough in others. And so that's why the lectures aren't being chopped up exactly into their little hour segments, because in the summer I get some extra time to talk about things that I like to talk about, and so I thought I would go through some of the chapters of this book. And so in the last lecture we started the world of pharmacy and pharmacy technicians, and we're going to finish that up right now and start talking about, finish up that chapter. And at the end of the chapter, they talk about medication therapy management, MTM. And this is very important because this shows this expanded role, this expanded scope of practice for a pharmacist, and that includes things that are delegated to the pharmacy technician, and something that is showing the need to expand the scope of practice of a pharmacist is this right here, medication therapy management. It's a distinct service or group of services that optimize therapeutic outcomes for individual patients. Well, I thought that was interesting, and during the break, what do? I just sit and run it through Google and see what comes up. And as I was doing this, this came up from the CDC, and I'm sure you can't read it, but that's how I found it. If you Google CDC, this will come up, and then someday I'll take this. And someday I'll learn how to use an Apple. But right up here is cdc.gov/heart disease. This is the DHDSP website, and that stands for their Division for Heart Disease and Stroke Prevention. I knew this was on here. So right now we're talking about medication therapy management. There it is right there. Gee, I wish I knew how to operate an Apple. There we go. See if we can make it a little bigger. That's fine. All right, and so here for the Center of Disease Control and Prevention, we are in the Division for Heart Disease and Stroke Prevention. And they're talking about pharmacy community pharmacists and medication therapy management. And here it says, medication therapy management is a distinct service or group of services provided by healthcare providers, including pharmacists, to ensure the best therapeutic outcomes for their patients. MTM includes 5 core elements: medication therapy review, a personal medication record, a medication-related action plan, intervention or referral, and documentation and follow-up. And so I think this is an excellent description right here of what medication therapy management is. And so here they're giving the medication therapy management description in the context of cardiovascular disease. And so let's see if we can make this a little bit bigger. Good. Yeah, I can barely read it now. Okay, so within the context of cardiovascular disease, medication therapy management can include a broad range of services, often centering on the following: identifying uncontrolled hypertension. This is something that we talked about earlier, where pharmacists will identify someone who's not getting their medications, not taking their medications. Their hypertension is uncontrolled. And with MTM, we want to be able to identify uncontrolled hypertension. We want pharmacists to be able to identify uncontrolled hypertension. That's why there's a place at the pharmacy usually to check your blood pressure. Checking your blood pressure once doesn't make hypertension. Checking it repeatedly and having elevated levels, elevated blood pressure readings, that defines hypertension. And so part of MTM is to identify at least in the cardiovascular setting, identified uncontrolled hypertension patients. It also involves educating patients on cardiovascular disease and medication therapies. I think I'm set up to do that on June 15th to do a talk on cardiovascular disease and medication therapies as part of a project to decrease cardiovascular risk of morbidity and mortality in the community. And then advising patients on health behaviors and lifestyle modifications for better health outcomes. I listen to somebody talk all the time who believes that this should come from a doctor. And I think it's very interesting that, well, of course this should come from a doctor. However, doctors are busy with lots of things, and health behaviors and lifestyle modifications, that doesn't need to come from the doctors. That needs to come from everybody. That needs to come from social media. That needs to come from the national media. That needs to come through our entertainment and our movies, and then having healthcare workers advise this sort of thing. When we have a culture that does not promote healthy behaviors and lifestyle modifications, and then you're not going to have a healthy culture. I don't want to get too much into this, but I thought it was interesting that I was watching Headline News. I won't mention the organization, but they took a break. They were talking about gun control, and this was a long time ago, and then they took a break for a commercial, and there were all sorts of supermodels dressed in skimpy clothes, firing all sorts of firearms at each other. And I think during that commercial there must have been 10 different firearms, and I think they must have fired off at least 500 rounds in that short commercial. Then they went back and had a discussion about gun control. And to me, that seems ridiculous. I don't see how you can promote healthy behaviors and healthy lifestyle modifications when we have a community, when we have a culture, we have this entertainment culture that does not promote that. And so I'm specifically addressing people who stand up and say that doctors aren't doing enough to promote healthy behaviors and healthy lifestyle modifications. And looking at this, I would suggest that all healthcare professionals be in a position to advise patients on healthy behaviors and healthy lifestyle modifications, and also let our patients know that these sorts of behaviors are not being promoted when we see the national media and the forms of entertainment that they put in front of not only our community members but our children. So it takes more than just doctors to promote healthy lifestyle modifications and healthy behaviors, because this is what's most important about all of this, not the pharmacology, is healthy health behaviors. If you behave in a healthy manner and adjust your lifestyle for better health outcomes, you won't need medication. I have seen all sorts of diabetics who have been able to control themselves with diet and exercise. I've seen all sorts of diabetics who couldn't, but there are plenty who made the commitment to make the lifestyle change, and there are plenty of diabetics. I thought there is no way that they control diabetes exclusively with health behaviors and lifestyle modifications and no medications. I saw several patients, and they were able to treat and take care of their diabetes mellitus type 2 quite simply through healthy behaviors and lifestyle modifications. And so when I go and give this speech about educating patients on cardiovascular disease and medication therapies, I think we're going to really start talking about healthy behaviors and lifestyle modifications, because that's what we need to do to prevent using so much pharmacology in the community. Routinely on this campus, when I say, oh, I teach pharmacology, and they say, oh, well, you're the one trying to poison this island, and that's quite unfortunate that I would hear that from academicians on this campus. But really the purpose of this course is that if we can educate patients on healthy behaviors and lifestyle modifications, we won't need to use so many medications out there. If we can identify uncontrolled hypertension patients before they need medication and get them, or if we can see pre-hypertensive patients before they need medication and get healthy behaviors and lifestyle modifications into their culture, then we will use less medications. All right. All right, well, now that I've gone on that tangent, we can continue with medical therapy management or medication therapy management. And again, this is describing the importance of expanding the scope of pharmacists and other healthcare professionals to work in a collaborative way to have better outcomes for our patients, and I am all about that. I love collaborating with groups of physicians. I love it when I see cases that have been seen by other physicians, and I get to review the charts and have an opinion about what's already been done. That's one of my favorite ways to practice medicine. Practicing medicine alone in an emergency room, having nowhere to turn or ask questions, that's no fun at all. And so I want to see medical healthcare. I'd like to see pharmacology. I'd like to see this course become more collaborative and include more opinions. So the point is this, medication therapy management, MTM, is especially effective for patients with multiple chronic conditions because these are very difficult patients to take care of. They have complex medication therapies, and one of the problems with over-specializing with medicine is there's not one single person who can oversee all of this and make it come together. And so now we're turning to the pharmacists. When I was in rural practice as a general practitioner, taking care of complex chronic conditions, that manager was me and me alone. But there are less physicians like me out there and more who are specialized in a certain specialists in certain chronic conditions, but not other chronic conditions. And so you have several specialists taking care of several different chronic conditions. There needs to be somebody who can communicate, understand those conditions, understand the medications involved in those conditions, and be able to communicate complex problems with the different specialists. And so having our pharmacists be involved in MTM is especially effective, especially with patients with multiple chronic conditions because they have very complex medication therapy needs. It's especially effective for patients with high prescription costs. It makes sense with multiple patients with multiple chronic conditions, and complex medical therapies are going to have high prescription costs. And obviously there's multiple prescribers again. And this is really one of the big problems that we have in pharmacology. And the transition that we've made from having a robustly educated general practitioner to now we're training people in to be general practitioners that have very limited scope. And so with the general practitioner having a very limited scope, the general practice provider having a limited scope, and then each of the specialists having a very limited scope of practice, it's just really difficult because now we have these different prescribers. They're not necessarily communicating with each other, and we need somebody to take a look at all that and be the quarterback. And in the old days, that was me. Now we're turning to the pharmacists and say, hey, can you help us with taking care of these patients with multiple chronic conditions, complex medical therapies, high prescription costs, and all sorts of multiple prescribers. And over the years, when we've thought about what to do with that, we're looking to the pharmacies and the pharmacists to help us with this. And so medical therapy management or medication therapy management can be performed by pharmacists with or without an official collaborative practice agreement. And it's a strategy that is considered to straddle the main domain 3 and domain 4. If you guys find this, you can click on them. But healthcare interventions and community clinic. And so these MTM is very effective way to manage patients and manage their medications. And so the PowerPoint slides that you guys have, that I have from the board review, they have very limited explanation of MTM, and I wanted to go through this website and show you really how important all of this is. And so we can look at the evidence of effectiveness of MTM, the evidence of impact, implementation considerations, and so evidence of effectiveness. Strong evidence exists that the use of MTM by pharmacists is effective, very effective, although the exact combination of MTM activities tends to vary between settings and persons and patients. Studies examining this have generally found MTM to be effective and strong internal-external validity. MTM trials have been replicated in different contexts with great results, and the implementation guidance on MTM is available from several sources, and there is guidance under Medicare Part D. Medicare Part D is involved in prescription benefits for Medicare recipients, and there is a description of MTM in the Medicare Part D literature. And then there's more stories here. Let's see what we have evidence of impact. So I think what they're trying to show you here, evidence of effectiveness, implementation guidance, research design, internal validity, independent replication, external ecological validity. And this means well supported, and you can see what that means. So let's see what our evidence of impact is. Health impact, yes. Health disparity, that's insufficient. Economic impact is supported. And so when we're using MTM to impact our community, we're impacting their health, we're impacting the economics, but MTM is not helping us with health disparity impact. And health disparity is a completely different subject. I went to a conference on health disparity when Josh Green was first elected as a senator, and that's when I got to meet him. And it was an excellent presentation. I have those slides. I'll go find them, and we'll talk about health disparities in this class on one of my free days. All right, so medication therapy management has been implemented in several settings, including federally qualified health centers. These are groups that get together and share data in such a way to show the effectiveness of what they're doing. Patient-centered medical homes, managed cares, health centers, community pharmacies, hospital pharmacies, and primary care clinics are all implementing this medication therapy management. It's supported by the Centers for Medicare and Medicaid Services. CMS, they don't put two M's for Medicare and Medicaid, they just put one. So CMS is the Center for Medicare, which is insurance for people over 65 years old. It's a little more complicated than that. Medicaid is also federal insurance, but it's carried out by the state, and it's for people of low income who cannot afford health insurance. And so anyway, this is being supported by Medicare and Medicaid. For MTM to work most effectively, pharmacists and prescribers develop practice agreements and shared blood pressure management protocols. And so, again, we talked about this earlier. I get a phone call from a pharmacist, and he said, well, this patient has run out of medication, their blood pressure is sky high. So I went ahead and gave them this. Can you sign off on that? In the old days, that's what I do. Nowadays, the pharmacist can take care of this even if they don't have a specific practice agreement with the prescriber. And American Pharmacists Association's MTM Central. You were leaving the CDC website. That's okay. Let's see what we come up with. I don't get to surf on the net. You know, everything in Pharm 203 is so regimented and canned that sitting in front of a camera and searching for stuff is fun. And so, you know what, I'm going to take this website and I'm going to stick it on my slides, and we'll look at it some other time. But it is portal.pharmacist.com, the APHA MTM Central. So I'm sure if you just put these words into Google, this will come up. And so this is going to be something fun to talk about as we go through pharmacy technician. However, that's enough for today. So, back to our slides, medication therapy management is a distinct service or group of services that optimize therapeutic outcomes for individual patients. And this includes assessing a patient's health, designing a medication plan for the patient, selecting, starting, changing, or giving the medication, monitoring the patient's response to the medication, looking for medication-related problems that the patient might have, documenting and communicating other healthcare professionals, educating the patient about the use of the medications, and then coordinating these services with other healthcare services. And the first thing that comes to people's mind is like, oh, well, that's what the doctor does. And if you ask the old doctors, they'll say, oh, well, yeah, that's what we're supposed to do. But again, we're training people to be very specialized. And when you have a lot of different specialists taking care of one person with a lot of chronic conditions, we need somebody who can look over the overall medication strategy and making sure that it's actually providing therapeutic benefit for the patient. Because again, it's about risk and benefit. And by using more and more and more different medications to treat the various chronic illnesses, we're just incurring more and more risk naturally, because by using polypharmacy, by using different medications, we're increasing our risk of toxic interactions. And that's the last thing that we want. And so we're moving this responsibility from the general practitioner over to the entire healthcare system, and pharmacists and pharmacy technicians are going to be essential to making this work because this is working, and we're going to see this more and more. Get used to the fact that technology is going to get used more and more as well. Automation allows more staff, more time for clinical pharmacy services, and so the more we can get a robot to do things like count and barcode and make sure accurate dispensing, then we have more time to talk to people and take care of them. And so something interesting that I didn't know last time I took a tour in a pharmacy is the pharmacist or the pharmacy technician. The pharmacist will first approve the prescription to go to the pharmacy technician, and then the pharmacy technician counts the pills out. And then they put it in this tray, and they put it in this box. In a box, there's a camera in the box, and it takes a picture of it. And the pharmacist, it goes to their computer, and the computer can count the number of pills. The computer can identify the markings on the pill, make sure that it is correct. And so we're using automation more and more to increase our accuracy, but it's also giving us more time to talk to people. So technicians are going to have an increasing role operating, managing, and maintaining these new systems. More and more, we want to switch patient costs over to the outpatient setting, ambulatory patients. If you've been around long enough, you know in the old days, you'd have some procedure done in the hospital, and you'd stay a long time until they thought you were ready to go, and that was really expensive. And now we're at an age where you get a procedure done and you're out the door immediately, if not 24 hours later. I know people who've had knee replacement surgery and been discharged the next day. In ancient times, you get a knee surgery, you'd stay in the hospital for more than just one day. And so again, by getting patients out of the hospital sooner, we save money, but by getting them out of the hospital sooner, we incur risk because they might have some problems down the road that we need to be aware of. And so as we decrease healthcare costs by providing more care to ambulatory patients sooner, we're going to need to be more vigilant about being on the lookout for problems that patients can still have, because again, the patients are being discharged from the hospitals earlier. There are same-day surgery centers. You walk in, you get your surgery, and you're not even staying overnight. There's all sorts of diagnostic tests that can be done on the outpatient basis. And so as we decrease our reliance on inpatient hospital care, we are relying more and more on people who are providing care to the ambulatory patients, the patients who are not admitted in a hospital. So in summary, pharmacy technicians are very key professionals who can be found in virtually all pharmacy practice settings, and they perform their jobs with a high degree of professionalism, which is why we require more and more education. And this is critical to the success of the operation of any pharmacy. We can't have successful pharmacies in our community without really well-educated pharmacy technicians. And as pharmacology explodes in the knowledge base, and as the number of medications available continue to grow rapidly, as we continue to send patients home sooner and rely on ambulatory services, as we rely more and more on our pharmacists to manage complex situations, the more and more we need our pharmacy technicians to be very well educated. And that's where there is a growing demand to take the pharmacy technicians and make that an associate's degree. And so going through these slides is at least a first step. So given the changes occurring in the pharmacy profession, the role of pharmacy technicians in all settings is expanding, and more is expected from technicians than ever in the past. And so I think we've made that point. So as a team, pharmacists and pharmacy technicians to work to improve patient care. Now that's what we want. We want to optimize their outcomes. We want to maximize the therapeutic benefit that they're getting from the medication while minimizing risk that goes with that. And that means avoiding medication errors. Right patient, right drug, right route, right dose, right time.